Hey everyone, my name is Madeline Stewart, and I'm a first-year resident heading to Hopkins for radiology this summer. I'm excited to be a part of the ACORE blog series, and I will be presenting based off the article Advances in Nail Evaluation, Ultrasound, and MRI. This is a publication from Radiographics, and if you're interested in more details or the sources used for this presentation, please take a look at my full blog and sources below. My presentation and blog are entitled Advances in Nail Evaluation Using Ultrasound and MRI. And like I said in the last slide, this is a blog based off a publication in Radiographics by authors Zatar et al. It provides updates on nail apparatus imaging, as well as providing multiple helpful review cases with wonderful diagrams and MRI and ultrasound correlates. Nail apparatus disorders range quite widely. It can be something like a simple benign inflammatory condition, it can be an infection, or it can even be a neoplasm like a malignancy. Accurate diagnosis can be challenging for these conditions because of overlapping clinical features and limited visualization of subungual or periungual structures, especially in the setting of edema or inflammation. Imaging plays a very valuable role in evaluating pathology of the nail and in guiding surgical planning. Because imaging modalities like ultrasound and MRI enable the visualization and evaluation of subungual and periungual structures, they have become a valuable aspect in diagnosis, in guiding surgical planning, and even identifying treatment response in some conditions. This article describes how high-frequency ultrasound and MRI are the best modalities for providing the detailed visualization of nail anatomy and pathology needed for best patient care. The primary structures of the nail apparatus are the germinal matrix, the nail bed, the nail plate, and the periungual soft tissues. The nail apparatus contributes to tactile sensation and thermal regulation. Because pathology may arise from any of the anatomic components, an accurate and detailed knowledge of the nail anatomy is necessary to properly interpret findings on physical exam and on imaging. As I said earlier, the article this blog is covering provides many helpful diagrams with ultrasound and MR correlates that are great for learning. Imaging with X-ray or CT produces limited diagnostic information for the nail apparatus, especially considering soft tissue, which is why other modalities, discussed in more detail soon, are important. Regarding X-ray, it can be used to assess osseous involvement, think a trauma or some kind of chronic infection. However, it provides minimal soft tissue detail. CT is rarely selected for the initial modality when evaluating for a nail pathology, but it can definitely help identify subtle bone involvement in patients who are unable to receive MRI evaluation. High-frequency ultrasound has emerged as a first-choice imaging modality for evaluating the nail due to its accessibility, its real-time capabilities, and its high spatial resolution for superficial structures. High-frequency ultrasound requires transducers that use frequencies above 15 megahertz. This enables a detailed evaluation of nail morphology and vascularity. MRI, especially when dedicated nail apparatus protocols are utilized, provide superior spatial resolution and soft tissue contrast characterization. The dedicated nail protocols involve 3T machines and surface coils. The MRI is often used as a problem solver when ultrasound findings do not deliver a conclusive finding or when there is suspicion for deep structure involvement, because MRI is superior for evaluating deep structures of the nail. A key advantage of MRI over ultrasound is that MRI is able to detect early bone invasion, which directly impacts surgical planning. For both ultrasound and MRI, the article recommends acquisition protocols that I found quite interesting, including positioning, the use of ultrasound gel in the MRI, and the use of a water bath for obtaining the best possible ultrasound. Regarding key evidence and recent advances in MRI now allow detection of very small lesions and better evaluation of tumor extent. Earlier studies suggested a reduced sensitivity of MRI for very small glomus tumors, so tumors less than 3 millimeters. However, advancements in imaging protocols, including the use of surface coils, as mentioned in the last slide, have significantly improved detection, allowing for reliable identification of glomus tumors smaller than 2 millimeters. So you can see that there have been improvements for unable to find less than 3 millimeters to reliable identification of tumors less than 2 millimeters. MRI also plays a critical role in evaluating subungual melanoma by defining the lesion's extent and involvement of adjacent structures. Continuing with the key evidence and recent advances addressed in the article, advances in high-frequency ultrasound have enabled reliable assessment of the nail apparatus. This modality can differentiate dorsal and ventral nail plates, measure nail thickness, detect subungual masses in some cases, and assess vascularity using Doppler imaging. These capabilities support its role as a first-choice imaging modality in nail evaluation. Finally, the article addresses the complementary nature of the two modalities. Emerging evidence supports combining high-frequency ultrasound and MRI for comprehensive nail apparatus evaluation. However, in cases when one or the other needs to be selected, it should obviously be based on clinical context. For example, high-frequency ultrasound is superior for evaluating dynamic and superficial changes, like nail plate discontinuity and thickening, as well as detecting subungual fluid collections or small hypoechoic masses with associated hypervascularity on Doppler imaging. MRI is superior for evaluating those deeper structures and earlier osseous involvement, like discussed earlier. These include detecting bone marrow edema and infection or tumor invasion and characterizing the full extent of subungual melanoma or glomus tumors within the nail matrix and adjacent soft tissues. Clinically, high-frequency ultrasound assessment offers rapid, cost-effective, and dynamic assessment, making it ideal for initial nail apparatus evaluation and follow-up of nail pathology. It improves detection of structural and vascular changes in inflammatory, infectious, and neoplastic conditions. MRI is most valuable in complex cases when malignancy or deep tissue involvement is suspected. The detailed anatomic delineation provided by this modality also aids in surgical planning and reduces the risk of incomplete excision in cases where that must be performed. Interestingly, imaging may also detect early or subclinical disease states, such as nail involvement in psoriatic arthritis, allowing earlier diagnosis and intervention. Finally, let's review some main takeaways from this article. High-frequency ultrasound is a valuable first-choice modality for superficial nail pathology. MRI is superior for detecting deep tissue involvement and early bone invasion. High-frequency ultrasound enables detailed assessment of nail apparatus morphology, thickness, and vascularity. Dedicated imaging protocols improve the diagnostic accuracy in nail evaluation. Advances in ultrasound and MRI have significantly improved evaluation of nail apparatus disorders, addressing limitations of clinical examination alone. These complementary modalities enable accurate diagnosis, guide treatment planning, and in some cases, identify therapeutic response. As imaging technology continues to evolve, its role in nail pathology will likely expand, supported by standardized protocols and increasing clinical integration. For radiologists, a strong understanding of nail anatomy and imaging features is essential to provide accurate, clinically meaningful interpretations and improve patient care. And that concludes my presentation for this blog. Thank you so much for watching. I hope it gave you a clear and concise overview of my takeaways from this valuable article, Advances in Nail Evaluation, Ultrasound and MRI. For more information and more details, please see the blog below. Thank you.